Idelvion Vial is used to prevent or control bleeding in people with little or no factor IX, which is a protein in the blood that helps the blood clot and stop bleeding. This medication is specifically for those with hemophilia B or Christmas disease. It should not be used for other types of factor deficiencies or to reverse the effects of blood thinners. The dosage and timing of Idelvion Vial will depend on your specific condition and medical history, so be sure to follow your doctor's instructions carefully. Before starting Idelvion Vial, make sure to read the patient information leaflet from your pharmacist and ask your doctor or pharmacist if you have any questions. This medication is given by injection into a vein over several minutes as directed by your doctor. The dosage is based on your medical condition, weight, and response to treatment. If you are giving this medication to yourself at home, learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for particles or discoloration. If either is present, do not use the liquid. Learn how to store and discard medical supplies safely. The medication in the vial and the supplies that come with the medication should be used only once. Do not reuse. It is important to limit the amount of blood entering the tubing and to avoid letting any blood enter the syringe for some brands. You may need to use a new vial of medication and a new set of supplies if this occurs. Consult your pharmacist for details. Make sure to tell your doctor if your condition lasts or gets worse. Some common side effects of Idelvion Vial may include fever, pain at the injection site, chills, headache, flushing, weakness, nausea, or vomiting. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. However, it's crucial to inform your doctor immediately if you experience any serious side effects, such as swelling at the injection site, shortness of breath, rapid heartbeat, signs of kidney problems, like changes in urine output, swelling of the ankles/feet, or pain/redness/swelling of the arms or legs, as well as new or increased bleeding/bruising. In the event of very serious side effects, such as bluish fingers, chest pain, or difficulty breathing, seek medical help immediately. Although rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not an exhaustive list of possible side effects, so if you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist for guidance. If you are in the U.S., you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you are allergic to factor IX products or have any other allergies, make sure to let your doctor or pharmacist know before using Idelvion Vial. This medication may contain inactive ingredients that could cause allergic reactions or other problems, such as latex. Make sure to discuss your medical history with your doctor or pharmacist, especially if you have other clotting disorders, have had recent surgery or have liver disease. Before undergoing any surgery or dental procedure, inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, only use this medication if it is clearly needed and discuss the risks and benefits with your doctor. It is not known if Idelvion Vial passes into breast milk, so consult your doctor before breastfeeding. Remember to always follow your doctor's recommendations regarding the best time to take this medication and the correct daily dosage. When taking Idelvion Vial, it's important to be aware of potential drug interactions that may affect how your medications work or increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's crucial not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Idelvion Vial include drugs that help with clotting, such as aminocaproic acid and tranexamic acid. It's essential to discuss any potential interactions with your healthcare provider to ensure the safe and effective use of Idelvion Vial. If someone has taken too much Idelvion Vial and has severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the US, you can call your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It is important not to share Idelvion Vial with others. Your doctor may recommend lab or medical tests, such as factor IX activity, while you are using this medication. It's important to keep all medical and lab appointments and consult your doctor for more details. Remember to take Idelvion Vial as prescribed by your doctor. If you happen to miss a dose, make sure to consult with your doctor or pharmacist to establish a new dosing schedule. It's crucial not to take double the dose to make up for the missed one. Be sure to follow the storage instructions provided with the product and ask your pharmacist for any specific details. It's important to keep all medications out of reach of children and pets. Avoid flushing medications down the toilet or pouring them into a drain unless specifically instructed. When the product is expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.